As part of the Safe and Separate Sleep campaign, Rachel Gonzalez and Jasmine Miller, registered nurses from the Great Lakes Bay Health Centers, is here to dive into the Maternal Infant Health Program, what it is, how it works, and the vital ways their team is supporting families in our community through education, outreach, and hands-on care. Whether you are an expecting parent, a caregiver, or just passionate about infant health, this conversation is one you won't want to miss. Rachel, Jasmine, I'm so happy that you guys are here to talk about the Maternal Infant Health Program. So to start, can you explain what the Maternal Infant Health Program is? What is it?
Yep. The Maternal Infant Health Program is a Medicaid-funded program. We offer services in the community directly with the patients where we meet them where they're at. So we work with the maternal side up to we can do up to 12 months postpartum for pregnant women. So we try to meet monthly, at least 9 visits throughout their pregnancy for education and empowerment to educate throughout their pregnancy and postpartum stage. And we also cover infancies as well. So we usually typically enroll baby after mother completes the services, and then we work with the infant up to 12 months. And we can also extend that if they live in the city of Saginaw up to 18 months. So we try to visit with them once a month, and we work on a different view for general milestones. Are they going to their appointments? Education on immunizations and things like that. So very education-wise and empowerment, non-judgment in their area and where they're comfortable at.
Why is this program so important to have?
I feel like this program is important to have because it is able to, first, it's in home also. So not only is mom and baby comfortable, but it provides a good learning environment a lot of the times too, because baby is an environment that they're familiar with. I feel like we bring a lot of education to the forefront for them. Yeah, a lot of times in office visits, we get a lot of it's really quick. So with this program, we're able to come in and answer your questions, and we can be there from 30 minutes to an hour. And if there's questions that you didn't get to ask your pediatrician or things like that too, we're able to provide education on. And sometimes there's questions that's hard to ask a doctor where we come in and we see you once a month, so we have a good rapport. So you feel a little bit more comfortable asking us and things like that too. I feel like it's also important for us to be in these spaces because we help with different resources that a lot of people are not familiar with. So if there is things that you're not comfortable with you're struggling with, but they're not comfortable speaking about as far as food insecurities or help with utilities and things like that, sometimes we're tied to resources that can help.
So the Maternal Infant Health Program, is this something that every mother can receive? Is it only, dependent on certain insurances? Speak to that.
Unfortunately, it is only Medicaid-based. But I would definitely encourage any pregnant mother, even if they do have a private insurance, to apply to Medicaid, at least to see if we can get a secondary, because we do accept it being a secondary Medicaid also.
Okay, nice. So I just also had a conversation with the doulas as well. So how do you guys work with doulas?
So doula, I like to say they're our sister program. Okay. So they are with us along the ride as well. I know Jasmine does a lot of co-driving with them and co-visits, but we coordinate care together. So it's a continuum of care with them also being CHWs, community health workers, because they are there to help us as well. Like, hey, we have a referral and our caseload and how quick we're in and out, because we're out in the field all the time in the community. So we refer to them a lot. So it's just very, communicative. Yeah. We have to work together because we're essentially the same goals. Our missions are very intertwined. We want to be in the community, addressing social factors, seeing what other peoples don't see when they go to the doctors. We're not in their home and seeing hey, you have mold on your roof. let's address this. What can we do? So that is the beauty of home visiting, because we're there with them and they get comfortable. They, they trust you. They learn to trust you. You're there not judging them, when you can get judgment at a doctor's office, at your parents, anywhere, especially as new moms, old moms. I got to listen to this or that. My family does this or that. So it's just kind of, just all working together. And it's a great thing, because we're at every single level. As far as backgrounds and degrees, but you can't tell, because we want to give the same information and education
across the board. Yeah, It is really nice too, because we have the medical background and things like that too. So sometimes our doulas will come with like medical questions, because they're not, the medical part of things. So it's nice to be a good support for them also. And it's nice. Sometimes we'll do visits together and I'm like, hey, it's preeclampsia. Let's no sodium. And then, but I have my doula with me too. So then the doula visits and she's like, you're eating hot Cheetos. What happened to low sodium? So then it's nice to, because they do see them a little bit more frequently. Our program, we just see them once a month. But now, pairing with the doulas, now they have additional support that can see them a little bit more frequently too, which is really nice. So as we're educating our girls on different things, we're kind of just educating our doulas at the same time too. So it's like, okay, have my back when I'm not here and I can't really, get on her about different diets and things like that too. So it's nice.
That is really amazing. And as I've said before with the doula interview, it sounds like there's just this village.
Yeah.
But I think the part where I'm also thinking is the mother who doesn't have the Medicaid insurance, and she's, in a sense, missing out on this village that,
I agree.
That's happening. So what can she do? I mean, outside of just applying for the secondary insurance, is there anything that a mother could do to get this type of support?
Well, I would like to say there are a lot of resources there that it's just not for low income or the underserved community. With pregnancy, there is Centering Pregnancy that offers both Medicaid and private insurance. And there's also like Nurse Family Partnership and things like that. They have different criteria as well. So they're not typically only just Medicaid. It's like first-time moms or, before 20 weeks, before 21 years old. So there's different programs in the community. I just don't think they're very spoken on. So a lot of people don't know about our acronym MIHP, for Maternal Infant Health, or even the new doula programs, across, Saginaw County now. So there's a few different ones. And I just don't think it gets talked about enough, even though we do go into the field to these fairs. There has to be a different outreach approach for that.
Well, that's why you're definitely here having this conversation, because, like I said, I'm learning. This is so fascinating. I was not aware of this infant health program. So I know you kind of speak about the home environment, but what does an appointment typically look like?
So it depends on if it's like a maternal appointment or an infant appointment. I'll speak a little bit about the infant appointments because I'm a former NICU nurse, so that's my jam. My girl here loves, she loves pregnancy and labor and all that stuff too. Okay. So for me, a lot of times I come into the home, so we'll say baby's like 9 months, because I had a 9-month appointment yesterday and he was so cute. But a lot of times by this time, babies are a little bit comfortable with us. They kind of remember our faces and things like that too, which is really nice. So I'll come in. I normally have a sheet where I ask a couple questions. And it'll be like, how is baby sleeping? How is baby eating? At 6 months, we start to transition over to like baby foods and table foods and things like that. So I'll ask, like, is baby's belly tolerating it? Have you seen like constipation or diarrhea? Things like that, just medical type of questions. So there's a thing, ages and stages questionnaire. A lot of times you see them also at the pediatrician office, but the pediatrician kind of just like hands you a paper, say, fill this out, and they kind of go. So it's nice because I also have the same paper, but we normally have like an ASQ bag with just little toys in it.
What's the ASQ bag? Sorry.
So it's the ages and stages questionnaire, but it has like little toys. So on the questionnaire, it asks like, can baby put a toy inside of a bucket and take it out and things like that. And it'll say like, does baby bang toys and things like that. So sometimes we do go into homes who they don't have the toys and things like that. So we have this bag. And so a lot of times we're just playing. But it's playing for baby, but it's me kind of observing baby and things like that, where I kind of just go down the questionnaire to see how baby development is. And it's also tracked for us. So we will do it like 2 months, 4 months, 6, is it like
You
9,
can do
12?
8, 9, 10, or whatever the visit falls on.
And so we just kind of keep track. And if baby is like a gray or something like that, we'll kind of work on it a little bit more, different things developmentally. And it kind of hits on communication, problem solving, things like that too, gross motor skills, fine motor skills. So it's really kind of us observing baby in their natural element, which is nice because where are they most comfortable is home. Yeah. So it really kind of like works out and things like that. So I kind of just go down the questionnaire but do it as far as like playing with baby. If I'm unsure about some things, like sometimes babies won't talk as much, like you're a stranger. I will ask mom, like, okay, well, how much is he saying? Is he saying brothers and sisters' names and things like that? And if there is some areas where there's like, okay, we can work on this a little bit more, I'll tell mom like different ways that we can improve that. And we like to start seeing like them eating with like their pincers and like different little things. And so I'll encourage like, let's try independent eating and things like that too. So that's kind of like what our appointments is. It's a lot of play, a lot of talking. I try my best to get like where baby is. So if baby's on the floor, I try to get on the floor and things like that too.
So you talked about the infant. What about mom?
So, I was a former OB nurse for many years, like almost 7 years. So they kind of have me on the maternal side. But I do also follow my babies that I work with their moms.
Okay.
It's really typically we try to get them in the first trimester, but sometimes when the referrals come in, it's like during the second or so, and which is okay because that's when more things start happening. Like we hit the milestone of 20 weeks. Heck yeah, we're halfway there. 24 weeks we're viable, things like that. So it's really, I track and monitor and do a lot of education and active listening because it's very important. A lot of them come in very timid and then they're like, oh, she probably talks a lot. Oh my God. And I don't know, but then we kind of like vibe out and I'm like, I'm a safe space. So what you can ask your provider, text me, call me, text your doula. They'll get in touch with me. If I don't know anything, I'll get in touch with somebody else. So it's more of like, getting to know each other, breaking that glass, building that rapport and trust so they know, like, I'm here to support you and your baby through your pregnancy and after. We want to keep families together. So it's a lot of that, building that bond, building the trust so they are comfortable with answering my questions and, hey, what do you got for me? You're in and out, you go to your OB and I know you have 20 questions and they're like, no, I don't. And then later on they're like, yeah, let's do a birth plan. Okay, I'm scared about this. I'm scared. So it's a lot of reassuring, a lot of education and a lot of encouraging advocating for themselves. So I'm major on advocating for yourself, especially with teen moms, first-time moms, overbearing family member moms, so it's just, we want to advocate for ourselves, educate ourselves so we can educate, our children on our own too, Yeah,
and I will just add to Rachel, and there's a lot of times too where you kind of go to the doctor's office and they're like, oh, it looks like preeclampsia. We're going to start you on a baby aspirin, and then they're gone. So then my girls are like, okay, what exactly is preeclampsia? How can we help it? How do we fix it? And there's so many questions. So then we can also provide that education, or a lot of times what we'll see is gestational diabetes, and they'll send our girls off to a dietitian, and the dietitian is like speaking foreign. It's like, okay, I have no idea what's the difference between a complex carb, a simple carb, what's going to spike, what's not. And so where we're in the homes of 30 minutes to an hour, where I can say, okay, let's break this down. The difference between a cereal versus eating oatmeal, whole grain oatmeal and things like that. And kind of take it from so much medical jargon to just like our everyday
Layman
conversations.
terms.
Yeah. And I think that is also why it's beneficial for us to be in the homes and things like that too, because I feel like they have so many questions, like medical questions, that sometimes they are afraid to ask, or sometimes the doctors are in and out. Or I've had a girl who did a 24-hour urine. She's like, okay, well, why? And it's like, so we had to took time to explain it, but she's doing it, but she's just not sure why. Or she takes the baby aspirin, but she's not completely sure why. Or they started her on a beta blocker, but she doesn't understand why, things like that. So we kind of also provide that additional education on things and stuff too.
This is really amazing. I'm blown away because I didn't understand it, and you guys are just amazing at what you're doing. And again, it just sounds like a village. That's all I'm hearing.
Yes.
It's like village. The support that's happening. So what are some of the outcomes that you're noticing once a family has completed this journey with you?
A lot of times they love us. They trust us a little bit more. So when we do hand them to other programs, home visiting programs like Birth to 5 and things like that, or early on, they're more receptive. Sometimes when starting out, they're a little bit more hesitant about allowing people in their home and in their space, which is completely understandable. But after kind of partaking with us and building a rapport, they're a little bit more open to it, which is great because early on has so many benefits for babies. So there's that. And then a lot of times too, I feel like we leave our families way more informed and way more educated and more comfortable with asking questions. Like Rachel said, we definitely want to empower them to advocate for themselves and advocate for their children. And so 12 months of me saying, girl, advocate for yourself. Eventually they kind of get it. And, and where they are speaking up and they are advocating for themselves. And also a lot of times too, when there's questions about immunizations or stuff they're unsure about, I definitely encourage them to do your own research. And so a lot of times I encourage them to okay, instead of just looking at this mom on Facebook because she made a post, how about look under .edu, .org, .gov. I'm like, they're going to come with information, but they're also going to come with, studies and scientific studies and things like that, where things have been proven, a little bit more than just somebody's opinion. So I feel like I also empower them with advocacy, but also education and research and how to do the research and how to look into things. And I think also just a better outlook sometimes on motherhood. Sometimes we get them and they're just like, I had this baby. What I'm gonna do with this baby, And so I feel like a lot of times we leave them in a good place, better than when we started.
I can say that it's definitely when they do complete the services, and it's backed by evidence too for the programs. When moms do a program like MIHP or home visiting, even if it's not in the home, it's in the community or in the office, they have an increased percentage of moms that don't participate in the program to take their babies to well visits, to be compliant with medical providers, and to keep on educating themselves and being more comfortable with their second pregnancy or third pregnancy, even if they do come back for resources and support, because that's why we're here, is for the support. And so I feel, and it is a sense of confidence that they have for themselves, especially when, you go back and see somebody and they're like, oh my God, Rachel, I couldn't have got through the pregnancy without you. My baby's a year and a half. We miss you so much. And it's just, I'm comfortable going to his doctor's offices now by myself. And I'm comfortable asking questions, and it's just like you can see the confidence and the change after you see them again in meetings.
It sounds like you're giving them life skills.
Yes,
I'll be honest.
It can be.
I was speaking with the other group, but I was in my 20s when I had my daughter, and it's like I was going to appointments and I hated it. Yeah. It was not a good experience. I felt like I didn't understand what they were talking about. Thankfully, I had family who was encouraging, but I was thinking what about the women who don't have that? And I wasn't big on advocating for myself. I was very shy and timid, but this program is really encouraging mothers to do that. So what about dads? How are they involved in this situation, in this program too?
So our questionnaire could be a little bit better when it comes to dads and things like that too. That probably is the only thing where I'm like, okay, yeah, we kind of need to involve dads, but there's been times where I met with dads instead, and I feel like it's nice because it kind of encourages dad to be a little bit more active. So I'm like, okay, well, what are you feeding baby? And he's like, and I'm like, yeah. So I'm like, okay, well, next time you try feeding baby or you prep food for baby and things like that. And I definitely try to also definitely encourage them, because I do feel like dads in the home are very important. And so, but not only just in the home, but also actively, in their engaging and things like that too. Even when I go to like the maternal visits and they're pregnant, I'm like, have you felt baby kick? Are you talking to baby? And I, give them the education, like baby can hear you, so we want you to also interact and things like that. We try to involve dad as much as possible. I will ask dads like different like ASQ questions, because they are like, especially as baby gets a little bit bigger, dads are like, oh yeah, he knows how to pull here. He knows how to do this and that, because that's dad's, area and things like that too. So we definitely, engage with dads, and we really want them to participate also in the program and things like that too. We try to get them involved as much as possible.
That sounds like an amazing program. And I mean, the reason, again, while we're even having this conversation, it also relates to safe and separate sleep. So how are you in this program, or as a team, how are you encouraging your patients in talking about safe and separate sleep practices?
Yeah. So we start with safe sleep talk at the very beginning. So there's a packet that we give with different community resources, but one of the packets is a back to sleep pamphlet. So from the very start, we talk about babies sleeping separately. We say ABCs of safe sleep. So alone, back, in a crib. So we'll discuss that. I always kind of encourage my moms to like, if we co-sleep in the beginning, your baby's going to be 5, still want to sleep in the bed with you. So, so if we can start at the very beginning, so that is like my speech of starting to empower them immediately, even if we are just like 20 weeks and things like that, but kind of give them to put it on their mind about it and things like that. And when we kind of get into 30 weeks and things like that too, we do help provide things like bedside sleepers. So it's like a bassinet that's right on the bedside, pack and plays and things like that too. So a lot of times what we notice is that people will co-sleep because they don't have anything else, because we serve, low income families and things like that too. So we do help provide those things also. And we'll talk about it even kind of 30 week-ish. I know it's also spoken about in the hospital too, so it's nice. But it is something that we kind of reiterate about safe sleep and SIDS and things like that. I know that's a kind of a sticky topic a little bit. It's hard to just outright talk about sometimes with the statistics and the numbers, but it is something that we do go over in appointments and things like that too, when I do have visits with moms. So we start at the very beginning, honestly.
So do you think, or have you received any pushback when it comes to these tools that you're telling them to do?
I have before, because a lot of times it's culturally to co-sleep. Like when my grandma co-slept, my mama co-slept, and this person co-slept and things like that. And I always want to validate their feelings, always. I never want them to feel like they're not heard. And I definitely understand that. Again, that's kind of when I approach them with the education behind it and the statistics and things like that behind it. Yes, your grandma, your mom, and all these things, they co-slept. Understandable. And I can understand why you feel like it's okay. And then that's kind of when the numbers come in and the statistics and what we do see. And we'll kind of have that conversation. It is not always easy. But, we still bring it up later because I do feel like it's very important. Safe sleep.
Yeah. And I feel the same way, and everybody's approach is different. So I don't like to tread lightly on a lot of stuff because we wanted to make it normal to talk about SIDS. We want to talk about respiratory illnesses and increased risk of a lot of things. And a lot of people don't know these factors, and we're used to like, I co-slept, my mom co-slept with me, and we're used to that. And we're gonna let you, we want you to do what you want to do to feel good as a mom, as a dad, as a parent. but we want to educate you and inform you like these things can happen.
Yes, and they
so
do
you're
happen.
educated, and they do happen. It's 1 out of 2 kids in, a month in Saginaw, I believe now. Statistics show that. So it's like we kind of need to normalize these fears of bringing up talk. So, it's in the risk identifier when we do infants, bringing them in. They'll sometimes say, yeah, we do sleep with them. No, we don't. Or you can kind of hear that pause, and you kind of just see at the house, like, okay, we got a full pack and play, girl. So
full of clothes.
Where is the baby really sleeping? And it's okay. Like, I'm not going to call anybody on you. I'm not going to judge you. Let's try harm reductions. Let's see what we can do, because I'm not changing your mind, and that's fine. Like, I'm okay with that. But what can we do to reduce these risks?
Yeah, and when she spoke about harm reduction and things like that too, I would definitely encourage my girls, okay, well, if you're co-sleeping at nighttime, let's start with taking a nap separately. Let's start putting baby in the pack and play or the bassinet for naps. Let's start, and at least when going to bed, lay baby down separately. A lot of times too, I always tell my girls to, as soon as baby get home, start putting baby back. I was like, by this time, when they're 4 months old, I was like, you'll be half asleep and you'll be putting baby back. I was like, because it's muscle memory at this point. Yeah. A lot of times when we the first night of just randomly oh, this was nice, the co-sleeping, I'm like, let's not even do it for one night. And let's build up that habit. And that's me empower them again to just put baby back. Just put baby back. Not only, and I tell my girls too, I'm like, and with baby is bassinet, you can spread out, girl. You can finally lay on your belly. It's get some good rest. Yeah. And baby's also getting good, safe rest also too. Yeah.
You brought up a good point as far as setting a timer. So is that something that you encourage, just setting a timer when you're going to sleep? What does that look like?
So a lot of times I just try to, what I normally see is our breastfed mamas. So they'll be breastfeeding. I guess it's everybody. They'll be breastfeeding, but baby is close. You are sleepy. It's middle of the night, things like that too. Even kind of bottle feeding and things like that. Setting a timer, it'll wake you, it'll wake baby. Yeah. So we're not falling into a deep sleep with baby still in the bed and things like that too. Yeah. And so it wakes you up and you're able to put baby back, and things like that too. Just kind of keep the muscle memory. Yeah.
Yeah. No, that is really awesome. Yeah. And I hadn't thought about it in that way, but you are exactly right, because all it takes is one time.
Yeah.
All it takes is one time. And then you constantly doing the same thing over. No, put them
back. And it's a habit.
Yeah.
I mean, a habit.
Yes.
Comfort.
I was going to say, yeah, because your baby's close, you're close, everybody's tired. And then, yeah.
Wow. Well, I really love that you are having these conversations and without judgment. And I know that's probably really hard, because I'm sure it's don't do it. Yeah. But you have to just lead with empathy. And that's what it sounds like that you are
definitely
doing. Yeah. So what would you say to parents and caregivers in our community who are unsure about these safe sleep recommendations, or they're overwhelmed? I think maybe coming into the home and then going to a doctor's office, TikTok, we're on TikTok, Facebook. Yeah. There's so many messages that are coming in. So what would you say to our parents in our community? How would you encourage them?
Well, so I feel like I encourage them because I try to become familiar with them. So, everybody has a different personality, and, me and Jazz are a little similar in our education wise, and I'm laid back, she's a little laid back. So it's easily to kind of establish a good, rapport and relationship. And so, I do have girls that, will bite a little back, and I'm like, all right now, okay, let's refocus. What is our end goal? What do you want to do for you? And how can I make you and your baby safe? So I feel like when you start getting into that routine of just and it's a muscle memory for me. I'm just used to being like, okay, now. So what, what are we going to work on? What is our next step? What is our next goal? Because now, you're done with co-sleeping. You want to be done. We have the resources. So how are we going to move that towards that? So, I do have, moms that did lose their babies. And I would be so freaked out because the second baby, I'm like, yeah, we're discussing safe sleep. We're going to do this. I got you a side sleeper, a pack and play. We're good. And then I go to my first visit and she's like, I'm sleeping with her and I'm so scared. And I'm like, okay.
Yeah.
How are we going to face this? What can we do? How can I support you? What can we do? So it kind of reassures them too, like, okay, I got somebody supporting me. She's not judging me. Yeah. She's not going to say nothing about me like my doctor did. My doctor told me I'm going to have a dead baby if I continue. Or, because it was said to me, honestly, because I co-slept. And, and it wasn't such a big topic back then. You know what I mean? 11 years old, I had my daughter, and my doctor, the hair pediatrician, blatant looked at me and said, "You're gonna have a dead baby." And I seen a lot of families, they don't get through it. They get divorced, and I was distraught because I'm postpartum, wise, right? And I'm like, oh my God, I'm gonna kill my baby. That's how I was feeling. Like, I'm gonna kill her. Like, oh my God. And it was the thought in my head and the franticness that I felt them next coming days and months. Like, okay, I'm just not gonna sleep. And so it's like even self-reflecting thing for me too, because a lot of the things that I'm like telling my moms, like, I wasn't educated on, because just like you said, and me and her, we were young moms, you know what I mean? The same age, very young, and we all had the same experience. And that is my major thing of these experiences that we have. We do not need to have them. Like, we do not have to have these systemic insecurities towards ourselves as young moms, as seventh babies, anything like that, or family pressures, anything. We don't need that from the community. We need the just love and support and compassion. And that's what our community in Saginaw is definitely lacking. But we have these programs and resources. I think it's just, we got to take the negative out of it. We're not here to call CPS on you. We're not here to judge you and be like, I'm never going over there. How do they live? We're not here for that. And if somebody gives you that feeling, speak up, because we don't want that in our community. We want, we got to bring some good light and good support and just come together, So I think that makes it all better. Like, they don't have that negative thing to think of, like, oh, she brought safe sleep up and I don't want her to come over anymore. You know what I mean?
And I piggybacking off of Rachel, I always try to tell them all the time, like, I'm coming to you from a place of love. I want the best outcome for you and baby. I want to leave y'all healthy and educated and alive and well. A lot of times what we see is the infant mortality death rates and the maternal mortality death rates. And I tell my girls this all the time, I don't want that ever to include you or your baby. And that is literally why I'm here. If I say something and you're uncomfortable with it, or you don't like my take on it, or things like that, I do try my best to give them the freedom to express themselves. And then I try to back up what I'm saying with education, but also, like Rachel said, lived experiences where I can say, this was a struggle for me because I didn't know any better. I did listen to what my mama and my grandma said and things like that too. And now I have the tools to make better informed decisions. And again, empowering them to make informed decisions. I'm giving you the information. I'm giving you the tools. I'm giving you the bassinets. I'm giving you the safe sleep swaddles. I am talking to you about these things. And or as far as like, a big thing I see all the time is if my baby throws up, they're going to swallow it and they'll choke and die, And so then that's this irrational fear. So we have this little pamphlet where it kind of shows how the airway works and how all the things work. And so not only am I telling you and giving you the education, I'm also showing you and things like that. And where it goes again, do the research, and I definitely empower them to make informed decisions. I understand how going against the grain may feel, But again, I want you guys to be as healthy as possible. And that's literally why I'm here. It's my job. But I love my girls. I love my babies. So, and I want y'all here. So that's kind of how I still, I feel like encourage them and things like that too, even if it is a hard topic for them. So, yeah.
I know you spoke a lot about community. And so I'm thinking about that right now as well. So how can the community support these new moms and mothers? How can they support them in practicing safe sleep?
Again, is lead with no judgment at all. I feel like that's a huge thing. A lot of times, sometimes it's about the delivery. Like, my aunt used to say, it's not what you say, it's how you're saying it, And so you can inform them without criticizing them. You can inform them without judging them. And I also feel like give them the room to also make the decision. A lot of times we come in and we're like, I gave you the education, I did this, I did that, do this, And sometimes, especially our young moms, they are tired of people telling them what to do. Yeah.
I'm sure.
Yeah. So I feel like, just by being less critical, less on them, it's a big topic. It's an important topic. And it's something that does need to be talked about. I just feel like a lot of the times we can kind of tailor how we're talking to them. Like when Rachel said the doctor was like, oh, you're going to have a baby. Let's kind of fix how we're stating these things. And I also feel like building a good community around them where we're all doing the same thing. We are all practicing safe sleep. It's the same across the board, which is a huge thing too. So I feel like we can improve that within the community a little bit. Yeah.
Yeah. And I can add to like the across the board thing. We want to give the same information as the provider, as the nurse, as the community health worker, WIC, everybody. We want to, it's got to be the same level and the communication and education out into the community. I do like to say what I think of a community, and especially as a pregnant woman or a new mom or how many, a primip, a multip, it doesn't matter what you are. Your community can be your support. So you may have a mom that doesn't have a mom, and that's horrible to not have a mom and you're becoming a new mom, or, oh my God, I wish I had this or that, or, they don't have a best friend. They came here out of an abusive relationship. They don't have nobody. There's nobody. And who can be their support person? Their OB provider can, their nurse that brings them to the room. What can I help you with? Social workers, doulas, but anybody, teachers, the peers, aunts and uncles. You see a mom walking around and they don't got a coat on. Don't judge them. Right. They couldn't afford a coat. Can I help you? Do you need something? Do you need assistance? So I feel like when we're more open and aware, things are going to change. So, and that's what we need. We really need to change our outlook on things. You see a 16-year-old mom, you don't know what happened. You don't know anything of anybody to ever judge them. So I think if we get rid of that mindset, everybody in the community, what matter education, it can be a homeless person, anybody, like it's just got to change in that view, because that's the support for the community.
Yeah.
Wow, one person at a time. That's what it sounds like.
Yes,
for me.
Really.
One person at a time. And I think that's what you guys are doing. I think that's what the doulas are doing. And there's a lot of programs, as you said, that I was unaware about. But it is amazing that people are now getting this support.
Yeah, I agree.
So thank you for doing the good work that you're doing. How can people learn more about this program? How can they be referred to you? Can you let the audience know?
Yep. So we can give referrals through WIC. And if you are part of Great Lakes Bay, because that's who we are through, the Maternal Infant Health Program, you can ask your provider about it, and they can refer that way also. Or we have a great clerk. Her name is Kathy Linton, and she can be contacted at 989-907-2747, and you can just kind of do a self-referral and things like that. Or if you got a doula, your doula can refer you too.
Nice.
Yeah.
Thank you so much, Jasmine and Rachel. Thank you so much for being here, and thank you for this conversation.
Thank you for having us.
Thank you.
Yeah.